Hi, today we'll be talking about understanding cerebrovascular accidents, causes, effects, and recovery as part of this month's Health Talk. We'll go through a few things. Firstly, we'll go through the introduction of what is stroke, also known as a cerebrovascular accident, the causes and risk factors, the symptoms and diagnosis, the impacts it has on the brain and body, what are the available treatment and rehabilitation, and some ways you can prevent as well as adopt in terms of lifestyle changes. So, introduction to cerebrovascular accident, stroke. So, a stroke is when blood flow to the brain is interrupted, which can result in a serious brain damage. Often called the silent killer, stroke can strike without warning and is painless the majority of the time. We have two major types. First type is ischemic stroke, and ischemic strokes are caused by blockages in the blood vessels, leading to reduced blood flow to the brain. Ischemic strokes are far more common, making up approximately 87% of all stroke cases. So majority of stroke cases are ischemic stroke. The other type is hemorrhagic stroke, and this occurs when there is bleeding in the brain, often due to a ruptured blood vessel. And this type accounts for about 13% of all stroke cases. Let's look at some statistics. Strokes are a primary cause of disability globally, impacting millions of lives every year. 1 in 4 adults over 25 will have a stroke in their lifetime. In Malaysia, there is an estimated 52,000 people experience strokes annually, resulting in approximately 6 new cases every hour. And it's important to raise awareness about stroke so that it can lead to early detection and better outcomes for those who are affected. The importance of awareness and early intervention. So early recognition and timely intervention significantly enhances recovery outcomes for patients with stroke, reducing long-term disabilities. Awareness campaigns educate the public on recognizing stroke signs, leading to quicker response time and improved patient outcomes. Another thing is we need to raise awareness on the signs and symptoms of stroke. So educating the public about stroke signs and symptoms is crucial for early intervention and saving lives. So we know the classic sign or classic method of distinguishing stroke from heart attack, so we can take a much more direct approach. Let's look at the causes and risk factors associated with stroke. Firstly is high blood pressure. High blood pressure is a major risk factor for stroke, as it can damage blood vessels in the brain. Okay, high blood pressure has been shown to have a direct correlation to a stroke. Mainly if blood pressure is high, it can damage arteries and cause blockages, which can lead over time to stroke. Heart disease increases the likelihood of strokes by affecting blood flow and leading to blood clots. Diabetes can lead to damage of blood vessels, significantly increasing the risk of stroke. Individuals with diabetes are roughly twice as likely to experience a stroke compared to those without. And then we have lifestyle choices. For example, smoking and excessive alcohol consumption are lifestyle factors that can elevate stroke risk significantly. Here we have a study that shows that excessive alcohol consumption increases the risk of stroke with over 1 million strokes linked to alcohol globally each year. And we touch on some of the medical and lifestyle risk factors, such as obesity and stroke risk. Obesity significantly increases the risk of stroke due to heightened blood pressure and cholesterol levels. Physical inactivity, for example, a sedentary lifestyle, contributes to weight gain and increases the likelihood of stroke and other cardiovascular diseases. High cholesterol levels can also lead to stroke. They can lead to plaque buildup in arteries, heightening stroke risk significantly. And then we should go through regular medical checkups. So routine medical checkups are crucial for monitoring health risks and preventing strokes through early intervention. Let's look into genetic predispositions as well. So genetic risk factors. Certain genetic factors are associated with an increased risk of stroke, highlighting the importance of genetics in health. Okay, according to this research, genes encoding products involved in lipid metabolism, okay, that's fats in the blood, thrombosis, and inflammation are believed to be potentially genetic factors for stroke. Family history also has a significant influence in an individual's susceptibility to stroke and other health conditions. So, a large systemic review from 2019 has found that your risk of stroke may be 36 to 44% higher if you have a parent or sibling who has had stroke or a history of stroke. Symptoms and diagnosis. So recognizing stroke symptoms, such as sudden numbness, confusion, and difficulty speaking is crucial for immediate response. Okay, a sudden loss of balance can be a critical sign of stroke, requiring immediate medical attention. So there's this acronym, FAST, which helps to identify stroke symptoms quickly. Okay, so let's look into that acronym, FAST. Okay, F stands for face drooping. So one of the classic signs of stroke is that one side of the face may droop, or the person complains that it's numb. So what we can do is test it by asking the person to smile and check if the smile is even or uneven. Because uneven is a classic sign of face droop, so let's tick or check this list of FAST. Next is arm weakness. So one arm may be weak or numb compared to the other. So ask the person to raise both arms and check if one arm is drifting downwards or not lifting at all. Okay, next is speech difficulty. Speech may become slurred or difficult to understand. Ask the person to repeat a simple sentence and check if they are able to do so correctly and coherently as well. Are you able to understand what they're saying? And lastly, time to call emergency. If someone shows any of these symptoms, call emergency services immediately. Time is crucial when dealing with stroke. Okay, every minute counts, because every minute is wasted. Is every minute the brain doesn't get any nutrients or supply of blood, which leads to injury in the brain. So diagnostic tools and procedures. Some of the tools that doctors may use in hospitals, for example, CT scans, which is a vital imaging tool used to quickly identify the type of stroke and assessing the brain damage. Okay, MRI may also be recommended, which helps to provide detailed images of the brain and helps to diagnose the stroke and other neurological conditions. Okay, this tool is usually commonly used for stroke. Another one is a blood test, which helps to evaluate stroke risk factors and guiding treatment decisions effectively. So let's look into the role of emergency response. So rapid emergency response is vital for stroke patients, as timely intervention can significantly improve the outcome. Knowing how to quickly contact emergency services is essential in a stroke situation to ensure prompt care. We don't want to waste time stuttering, so you need to know how to effectively communicate to the emergency line so that they will come as quick as possible. Prioritizing patient care during an emergency can help responders make quick decisions that save lives. Okay. So the impact on the brain and body. So how does stroke affect the brain function? Strokes can lead to significant cognitive impairments, affecting memory, reasoning, and judgment abilities. The severity of stroke plays a crucial role in determining the extent of cognitive impairment experienced by the individual. The location of the stroke in the brain significantly influences the type of cognitive functions that may be affected. If it's at the frontal lobe or the occipital lobe or parietal lobe, so where does the stroke attack or accident happen? Will determine where it's affected, most likely. Physical and cognitive impairments. So stroke survivors often face physical disabilities such as paralysis or weakness, affecting mobility and daily activities. Cognitive impairments can limit their ability to perform everyday tasks and affect overall quality of life for stroke survivors. Another is stroke has emotional and psychological impact on the individual. So after a stroke, individuals may experience depression, anxiety, and significant changes in their personality, which will affect their daily life. Psychological support plays a crucial role in helping stroke survivors cope with emotional challenges and improve their quality of life. So other than that is coping strategies. So implementing coping strategies can aid in emotional recovery process, providing tools for managing anxiety and depression. Let's look at the available treatment options and rehabilitation. So immediate medical intervention. So medications that dissolve blood clots are critical for treating ischemic strokes. Timely administration can significantly improve recovery chances. For hemorrhagic strokes, surgical interventions may be necessary to stop the bleeding and relieve pressure onto the brain. The speed of treatment is crucial. Quicker interventions lead to better outcomes for stroke patients. So time is of an essence. For long-term, physical therapy helps patients to improve their mobility and strength through tailored exercises and techniques. Occupational therapy focuses on helping patients adapt to daily activities and regain independence through practical strategies. And then we also have speech therapists who aids in improving communication skills, helping patients to articulate words and express their thoughts effectively. It will also help them to learn how to swallow food if they have difficulty swallowing post-stroke. Support systems and resources. Family, friends, and healthcare providers play a crucial role in recovery journey after a stroke. Their emotional and practical support can significantly impact recovery outcomes. Very true. Rehabilitation programs designed for stroke patients can enhance physical and cognitive recovery. These programs provide tailored exercises and therapies to aid healing. It's very true. And there's also a research that shows that the first 6 months after stroke attack is the golden period to go through rehabilitation programs to see a significant improvement. Support groups offer a platform for stroke survivors to share experiences and coping strategies. Connecting with others can foster a sense of community and encouragement. That's very true. So, what are the strategies in prevention and lifestyle changes? So, if you know that you have family members who had a history of stroke, or you have a heightened risk of getting stroke, here are some ways you can, or some methods you can adopt to prevent them or lower your risk of getting stroke. Firstly is regular exercise. Engaging in regular physical activity helps maintain a healthy weight and strengthens the cardiovascular system, which helps to reduce the risk of stroke. Consuming a balanced diet, which is rich in fruits, vegetables, whole grains, and healthy fats, helps to support overall health and stroke prevention. Regular medical examinations can also help to identify risk factors early, which allows for timely interventions that can help to prevent stroke. And also promoting awareness about the importance of health habits can motivate individuals to adopt prevention or preventative measures against strokes. So managing risk factors, effectively managing health conditions like hypertension and diabetes is crucial for maintaining overall well-being. Close collaboration with healthcare providers can significantly reduce health risks associated with chronic conditions, and regular monitoring of conditions such as stroke, such as cholesterol and blood pressure, is vital in mitigating potential health risks. Other than that, educational and community programs, stroke risk awareness. So educating the community about stroke risks can empower individuals to recognize symptoms early and seek timely medical help. Early recognition of stroke symptoms can significantly improve patient outcomes and reduce term disability. This is very true. There is a condition called TIA, transient ischemic attack, which is a warning sign for stroke. So recognizing that it's the symptoms of TIA will help you to select programs or select methods to intervene early so that you will not get the stroke. Participating in local health initiatives fosters community involvement and enhances public health education. So in conclusion, timely intervention in cases of cerebrovascular accidents can significantly reduce long-term effects and improve patient outcomes. Recognizing the cause and symptoms of stroke is crucial for prompt treatment and effective recovery. And implementing effective recovery strategies and rehabilitation can enhance recovery outcomes for stroke patients. And that's all. Thank you.